Hmm. Hi.
How are you?
I always start talking before and
I
then
know. I saw your lips move. I'm like, hi.
um I'm gonna give you the thingy. I think I'm gonna send it to you.
Oh,
Or maybe I'll share it with you. Share.
share whatever you want.
No, it's totally not this. But how do I share this? Great. Now I don't know how to share it. Why do I not have a share button? I should have a share button. Oh, there it is. Oh. Share, 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 share. I can't find my messages. Oh, there it is.
What?
Everything is changing. Okay. Here it is. Okay, you need to follow this guy anywhere in Instagram and YouTube, whatever. Just follow him. He's so smart. He knows what he's talking about. Just so you know that.
Like what? Wait. Hold on a second. I have to look it up.
He is a relationship expert, I would say. No, but for real, I was just watching what he's saying, and I'm just like, I've been looking how to tell my boyfriend something that he's been asking me to do, but I don't really want to do it. Not because I don't want to do it, but I'm scared to do it. And I'm just like, but I want to do it, but I'm scared to do it. And he was telling us how he just gave us like he just gave one example on this video that I just sent you. And
Matthew
I'm like,
Hussey.
dude, I can make that like example and twist it to my point, to what I want to do. So I was like, and he was talking about the bliss point that makes you just want to eat another, like, when you're eating, it's not too sweet, it's not
This
too
guy?
salty. Yes.
Yeah.
Yes.
That's so funny. I have friends who are already following you.
One of them is me.
Okay. Gotcha.
So I love how he talks, the way that, but on his accent, I'm like, ooh, I wish I was single so I could
What
date
is his
you.
accent like?
British.
Oh,
You don't like it?
I love it.
So and you're just like,
Except for when
you're
you have
right.
except for when you have to listen to like 4+ hours of like immunology by a British professor, then your ears start to hurt.
Did you have that?
Mhm.
No way. Dude, when I went to Scotland, I didn't understand them for the first 2 weeks. I was like,
It's
what are they
hard.
saying?
It's hard.
No, I didn't understand Scottish accent because they talk like this.
Oh, that's hard too.
Oh my god, they talk like, you're like, what?
Yeah, that's hard too.
I had to say what to one man like 6 times. I'm like, I'm so sorry, but I just can't understand what you're saying. Like, what was it? You're here. Oh, you're here for a holiday, but he didn't. And one of them asked me, "Are you here for a holiday?" And I'm just like, "What?" And he goes like again, and I'm like, it was like September, and I'm thinking, holiday? The only holiday that's coming up
Is
is
it December?
it's Halloween, and Halloween, they don't celebrate Halloween. Why would they think Halloween? And Christmas is not here yet. Why are they thinking? They meant
Vacation.
vacation. I didn't know that.
I know.
Evolution? Are you serious? We're back to evolution?
I know. Evolution. A little bit. But this is the heart system, how the heart has evolved.
Okay.
And I told the boy
What
about
did you?
my mom.
Oh, what did he say?
So okay, so he was like, because obviously I was studying because I have my mock boards this morning and then tomorrow again. So I was studying, and then he goes, so it was the following day, right? He says, so how did your consult with your mom go that you had to, after you so suddenly like hung up?
Mm-hmm.
And I was like, I am so sorry, but everything went well with my mom. But it's going to happen again. I'm so sorry. And he said, that's totally fine. And then he goes, is your mom the type who keeps calling until you answer?
That's what I asked you.
I didn't know it was a thing. Apparently it is a thing. And I'm like, no. And he's like, then why do you have to answer? And I said, I'll tell you some other time. And he's like, I don't want to pry, but if I was like, no, I said, so you really want to know? And he's like, I mean, I don't cry if you're not comfortable, but I mean, if you want,
I don't want to what?
he said, I don't want to pry if you're not,
Okay.
but if you're willing to share, yeah.
Okay.
And then he said, but again, I don't want to pry.
Mm-hmm.
I called him.
What? You called him?
I called it because this was like over text.
Okay.
He knew I was studying.
Mm-hmm.
So I called him, and then I said,
This is yesterday?
no, this was, so what's today? Thursday, Wednesday. This was Tuesday.
Okay.
Yeah. So Tuesday
Okay.
night. Yeah. No.
And then?
Yeah, Tuesday night. So then he was like, so I called him and I was like, wait, I don't want to pry if you're not comfortable. And I was like, you pried. You totally just pried. And you want to squeeze yourself into this. So I'm gonna have to tell you.
And then?
So I told him everything. And then he's like, I am so sorry. And he goes, I am so appreciative of the fact that you're sharing such a personal story with me when you don't really basically know.
Have to.
Yeah. And I was like, you know what? This is
Mm-hmm.
the first time that I didn't cry talking about this. Um, so it just shows that my mom is very, very, she's doing very, very well.
Mm-hmm.
So I told him I appreciate the fact that you gave me the opportunity to kind of, I guess,
Explain it?
yeah, double check that in my life,
Mm-hmm.
that I'm able to kind of confirm the fact that my mom is doing well and we are healing.
Mm-hmm.
And he was like, no, I totally understand. And then we talked about both of our families. So I ended up telling him pretty much everything about like my family. And he's like, where are your sister? Where is your sister? Where's your brother? What do they do? This and that, blah blah blah. So we shared everything.
That's nice.
I know, but it was. Is
That's a step
it too
forward.
early?
No. No, you guys have been talking for like 3 months now.
I know, but I just felt like we never listened. You know?
I don't think so.
You don't think so?
Mm-mm.
But yeah, and
You
then
didn't tell him my mom and dad used to fight all the time or something. You're not telling him that details. Right? You didn't, right? Okay, well, that's where you should be like, oh damn, I opened up. Like my boyfriend didn't know this much details, like, when you get into it with your mom or how your mom and your dad react, like if you have that type of mom and dad, sorry, till like our second year, which is this year. You know what I mean? That's when I knew I was able to open up to him. Or I needed somebody to open up to. You know what I mean?
I don't know. I don't know what you're talking about. I feel like I opened up
I
to.
mean, like it was not too soon. It's not too much to know. You didn't go in details.
I mean, went into detail about the situation.
That situation is different. You're not going. yeah, me and my mom don't get along about this, but me and my mom get
Oh
along
yeah,
about
no, I
this.
know,
She's
no.
my friend. Da, 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 da.
Yeah,
Me
no.
and my brother don't get along about this.
No,
My
no,
mom and
no.
my dad had a fight about you
Yeah.
didn't go this
No, no.
much.
Not at all.
Yeah, so that's different level. That's another level, by the way.
Yeah, that's another level. And I don't know if I'm gonna. But yeah, so I was like, afterwards, I said, "Are all the puzzle pieces coming together for you?" And he didn't say yes or no. He just said, I am so sorry. I didn't know that all this was happening. I feel like you have a lot on your plate." And he said, like, that's really stressful for you.
Mm-hmm.
Very empathetic about it, to the point,
That's nice of
like,
him.
oh my God, did I just overwhelm him?
No.
Okay. I love that heart. Thanks.
Yeah.
But
Oh,
yeah,
is she gonna notice it?
I know. He was like, yeah, thank you so much for sharing this with me. And he was very
Oh.
understanding. And then the following morning, I was like getting ready for class, right? It's 8:30 my time and it's like 6:30 his time. Like he woke up and he texted me.
Okay, nice. Cute. What did he, good morning, sunshine?
No.
He
He's like,
was thinking about you.
I think so too. Because he's like,
That's so nice of him.
it is. And he said it's so hard to get up when when it's so cold outside and you just want to stay in bed.
What did you say?
And I said, it's so hard to get up when you're up past your bedtime to
Oh my god, you guys are so like in that lovey stage, like da 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 da.
you know, right? And then
Love that.
that too.
What?
He goes, that too.
Oh, cute. But it's nice. He was thinking about you. Like, is she okay? Is she thinking? Is she da-da-da? And of course, he knows. Like, oh, she said this to me, so she feels comfortable.
Yeah. And I was like, okay, so because of that, from now on, I just want you to understand, if my mom calls, I have to answer. And he's like,
Mm-hmm.
like he can't say no to that now.
Yeah, no, no, no. Probably. Excuse me? You're gonna put your mom first? No, of course, no.
Yeah, yeah. So to me, it was so much better because now I feel comfortable enough.
Mm-hmm.
Be like, yo, I gotta go.
Yeah, 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 yeah.
Yeah. And last night I
Of
was studying, and he goes, how did it go with the shadowing with Perio? Did you like it? I know you're studying, and I don't want to take your time. So we can talk about it some other time if you want.
course.
And I was like, yeah, I want very well. Yes, I am studying right now. So, okay. And then he goes, well, if you need me to tutor, I'm here. It
So cute.
was really, really cute. So I did
Aw.
ask him a couple questions and I was like, okay, now I gotta go to bed.
You guys stay up late, late.
No, but seriously, past 2 nights, not yesterday. Yesterday I had to sleep, but Monday and Tuesday, I was up till 2 a.m. Obviously, I was studying, but I was also on the phone with him. About the
I
phone
know, I
call,
remember.
right? In the middle of the phone call, I was like, Lee, I'm looking at this problem for the past 10 minutes and I can't figure out the answer.
Can you hang up?
I know, seriously. And he's like, whoa, are you going over the question bank? And I was like, yeah, we've talked about this. I multitask.
Oh,
And he
so he
goes,
didn't know that you were doing that while you were talking to him.
yeah. And he goes, now I feel like, now I feel so special. Something like along those lines. Like, I feel so special that you were like giving me your undivided attention or whatever. He was being very sarcastic about it.
Yeah, yeah, I
I was
know.
like, we've talked about this. Come on. Just do one thing at a time.
They think guys think if you're not looking at them, if you're not with them, you're not listening. And then because sometimes I'm on my phone, I'm cooking, and my boyfriend is talking to me, and he'd be like, "You're not listening to me, right?" And I'm like, "No, I'm listening to you. What did I say?" And I tell him everything he said, and he goes like,
How did
"How
you?
are you listening to me?
Yeah,
You're not even looking." And I'm like, "I can multitask."
I know. Girls can multitask. Boys
Guys,
cannot.
yeah. Oh my god, don't tell me even about boys.
But yeah, that's where we're at. I don't even know.
It's good. It's going steady.
I think so. And then he texted me while I was in clinic. He's like, "How's it going?" And so I sent him a little picture of me, not full face, but just a little bit. And he's like,
Mm-hmm.
"But you're smiling under that mask." I was like, "That's sweet."
Thank you.
I just feel like he's the one now saying these things to me, and I don't say it back.
You don't what?
I don't say it back.
Well, that's what it's supposed to be first.
He's always saying like, "Oh, I really
My boyfriend used to
enjoy
tell me
talking
I
to
love
you."
you every every time we talked and everything. And one time I said it by mistake.
Yeah.
By mistake, I said it. I go like, I'm like, okay, I have to go. Sorry, yellow. And he goes like, okay, bye, I love you. And then I'm like, bye, I love you too. And I hang up and I'm like, damn, shit, what did I say? And then he was like, you said I love you too. I'm like, it was by mistake. I swear it was by mistake. It's gonna happen to you.
No, it's not.
Not I love you, but
I know.
something like sweet.
Oh, but yeah, he keeps saying like, "I really enjoy talking with you. I told you before that I would make time." But then he doesn't say the word girlfriend, obviously, because we're not there yet. You know what I mean? Like it's just little things like that. It's just
Okay. He's hinting. He doesn't want to come across very
forward yet.
mhm.
I don't think he wants to scare me off, but then also like that. But guess what?
Mm.
There's another boy.
Who? No, don't tell me, Danny. Don't tell me, Danny.
Oh no, hell's no.
Oh, then who?
No. So this boy, um, he is a D4, and my D1 and D2 year we did volunteering together.
Mm-hmm.
I thought he was the cockiest guy ever, and I didn't really like him. But there was one time where, like, because I'm a year below him, he would make us do things, including like doing the Halloween carnival and things like that. And like my friends and I, we would dress up and we would go to this Halloween carnival to host for the kids, right?
Mm-hmm.
But one day I was a witch and I was wearing all black, but I was wearing a little like black dress, like a mini black dress. And he looked at me and he kind of scanned me. You know, like how boys scan you, like top down. And then
I
he goes,
hate that.
"Adorbs," and I was like, "Okay,
What
well,"
did he say? What did he say?
he said adorbs,
Oh, oh no. Don't. Mm-mm. I don't
right?
like those
And I
guys.
was like, "What?" Like
No, he's too cocky.
too like sleazy.
But he's cocky because he knows maybe he's too cute, maybe he's something, maybe he's too smart. He's like, if I say that, she's not gonna come aggressive to me. Like because there is guys who every girl they'd be like hi to, they'd be like, oh yeah, let me go with you. So that's
No.
what I get from those guys.
Oh yeah. And
I
then
would rather somebody respectful.
oh yeah. And then yesterday when I was in clinic, I ended up needing to assist him. So I got paired up with him and I was assisting him on a frenectomy. And do you know what a
Okay.
frenectomy is? A frenectomy is, you know how like underneath your lips, like there's like that little membrane that holds
Mm-hmm.
your lips to your gum
Mm-hmm.
as
That's
well. Mhm. So sometimes that tissue is so close to your teeth that it brings your gum line down and then you have recession. So and then sometimes you have it underneath your tongue too. Uh-huh.
uh-huh.
When that happens, you know, it's really hard for you to chew, it's really hard for you to suck, it's really hard for you to do certain sounds.
Okay.
You have to get a frenectomy.
Okay.
Doing it. But then, so I was like assisting him on it. And then the patient comes in and he's doing small talk with the patient. And he goes, "Yeah, so Vicky here is going to be assisting me today, which is, you know, a little treat for all of us because we never really get assistance. But today, like, she's here to assist me, blah, blah, blah." And then he said something about, like, yeah, like, I remember everything about Vicky, but Vicky doesn't know anything about me. because I asked him, I said, are you specializing? And he's like, no, I'm just doing general, but I just want to like, get some experience, blah, blah, blah. And I was like, so you're
So he was doing he's just gonna
connecting me.
be a dentist and he can do that?
So you can at our school under the supervision of a periodontist.
Okay.
Yeah.
So and then
So then he was like, yeah, I'm actually going back to Florida. I'm just going to be a GP. But yeah, so yeah, like I remember everything about Vicky and what she wants to do, but apparently she doesn't know anything about me. And I was like, what? It's like, yeah, the last conversation we had was like 2 years ago and I still remember everything. It's like, what?
okay.
But the thing is, 2 years ago, when we were first doing all this like volunteering stuff and activities, in the middle of the night at like 1:30 a.m., he sent me a picture of himself skiing.
Why? By mistake.
I mean, obviously I ignored it till this day. I didn't say a word about it because I don't care. But
Or like
yeah, I was like, okay, number one, there's not a lot of Vickies in this world. um, and number two, why at 1:30 a.m. in the morning? At night, I mean. It just didn't make sense. You know what I mean?
I know. I understand. I don't know. Maybe some, well, you're gonna have a lot of that. But I told you before, when one comes, everybody comes with them. They just feel it, I feel like.
They do, they do. But it was interesting because
Or a girl gets more attractive when somebody talks to her. I don't know.
I have actually heard that. I have heard of that.
I've never heard of it. I just came up with it.
No, I've heard of it. But here's the thing. I mean, I can't tell Lee about it.
No, that's not.
Yeah,
No.
no, I can't tell Lee about it. But I just have a feeling that this boy is going to be more and
Open and outgoing, and he's gonna ask you something, and you're gonna be like, "What? What do you want from me? Leave me alone."
I know I'm totally ignoring him right now, but I can't because we're in the clinic together and
But instead of like, it would all change if instead of adorbs, he would have been like, "Hey, you look really cute today." That would have been different.
right? It would have been totally different. It would have been totally different. But he's so
Good for him.
yeah. I think Mariam, Lee is trying to he just randomly asks questions like, did you say you liked coffee? Or like, did you say you like this?
He wants to know what you like, what you don't like. That's cute.
Why do you know all this? How do you
Who? Me?
you
Me?
freaking relationship guru? But
Oh, not really. If I was a relationship advisor, I would have fixed my relationship.
anyways. All right, so fish has two chambers in the heart. The heart is nothing but a pump. Okay. The heart is nothing but a pump, and it's got two chambers. We have the atrium and then we have the ventricle. Do you see this?
What is it? Aventricle and ventricle?
Atrium
Oh, atrium.
and then ventricle. Now, through the atrium, blood comes in. Through the ventricle, blood goes out. Okay, and it goes to the gills, and then in the gills, it does gas exchange, so it becomes oxygenated. And in the bottom,
Atrium goes in.
yeah, ventricle comes out,
Okay.
and blood goes through it, and it's going to unload all the oxygen.
Uh-huh.
Okay, and then it comes back. But do you see how, because it's one circuit, both oxygenated and deoxygenated blood keeps mixing?
So the oxygenated one is the blue one?
Oxygenated is red, deoxygenated is blue. Think of blue being dead.
Okay.
All right. So it's not the most efficient way of doing gas exchange. So now we are going to go and we're going to look at amphibians. We are now going to have 3 chambers. And so this is actually becoming a little bit more, I guess, evolved. So we have atrium, ventricle, atrium. This is our body, and these are our lungs. From the body, we have deoxygenated blood come into the atrium, go through the ventricle, out to the lungs. From the lungs, we have oxygenated blood come into the atrium.
I'm lost already.
Goes and to the body. So we are doing our best to not, mix blood. But do you see how there's still a little bit of mixing happening?
Inside, right?
Yeah, there's a little bit of mixing happening in the ventricles.
Okay, so lung, and then body. So body comes through inside the atrium, out. Outside the ventricle to the lungs, then from the lungs inside the other atrium through the ventricle to the body. Wait, okay. So a little mixing. Okay.
Good?
Mm-hmm.
Okay. So now we are going to look at mammals. So mammals, we now have 4 chambers. Okay.
Mm-hmm.
So 4 chambers. This is basically, I know heart doesn't really look like this. I'm just going to draw like this. And then we will I'm going to blow it up later in a bit. But I just want you to see the 4 chambers right now.
Why are you blowing it up? Oh, okay.
From the body, we have deoxygenated blood come in. Okay, oh, here. This is the right atrium. This is the right ventricle. So it's kind of like the opposite, okay?
Mm-hmm.
And this is the left atrium, and this is the left ventricle. The way, oh, this is so bad. Okay. The other day, I was taking a radiograph of my own tooth, and I couldn't remember which side.
What?
I was taking a radiograph of my own tooth, and I was looking at it, right, on the screen, and I couldn't tell. Like in my head, I'm like, this is number 19. And on the screen, the assistant was like, Vicky, that's number 30. I was like, no, it's number 19. It's like, no, Vicky, that's on your right side. I was like, no, that's on my left side. What are you talking about?
Because it shows on the left side, on the other side.
Exactly. So I am so accustomed to just seeing at the patient
Uh-huh.
my own right and my own left. I'm such a
Ah.
So the way we do this is when you're looking at pictures, we are pretending that we are looking at the patient directly. So my right is their left. Does that make sense?
So this is not my heart. This is somebody else's heart. I'm
This
looking at
is
somebody
this
else's
is a
heart.
patient's heart. So convention is that you are looking at the patient as if they are laying in front of you with their head
Okay.
from you and their feet towards you. So their
Is
right
your left.
is my left.
Mm-hmm.
So,
Ooh.
so that's what the heart is, okay?
Okay.
God, I was such a dumbass. And I was
You had a moment.
oh my god, and I was trying to train a D1 too. And the D1 was like, no, that's number 30. We just took a test on it. I was like, no, that's number 19. He's like, no, I think that's number 30.
Oh my god.
Oh, I was so dumb at it. Okay, so from the body, it goes to the right atrium, right ventricle, and then to the lungs. From the lungs, it goes through the left atrium, left ventricle, out to the body.
What? I'm so lost. Sorry, I lost something. Um. hmm, Why is the deoxygenated blood going through the lungs again?
Because it has to go to the lungs to pick up oxygen.
So it has to go to the heart, to the lungs.
Correct.
Okay.
Good. Okay. But do you see how as we go, organisms are becoming higher and higher? They're gaining more and more metabolism.
Yeah.
Okay. Their metabolism keeps increasing. And then, with that being said, oxygenated and deoxygenated blood starts to separate.
Okay. Okay. Yeah.
Good.
Mm-hmm.
All right, so now let's kind of zoom into the mammalian heart. So I was looking at schools. I don't think I can apply to San Francisco.
What?
I cannot apply to San Francisco anymore, UCSF.
Why?
Tuition is so high.
Oh. Well, how much is it?
It's obviously for 3 years, but every year it's like 50,000. When other places they give you 50,000 as a stipend.
What would you mean?
So other programs like UCLA,
Mm-hmm.
they give you a $50,000 stipend as a resident.
What did I do? So I just want to do this. Sorry, I made something mistake. Okay, anyway, keep going. So you can get money from going to school?
As a resident, yeah, you're supposed to.
Oh, for residency. Oh, so you have to pay to be in?
So some residency programs you have to pay.
And they won't pay you?
They won't. UC San Francisco won't pay me for Perio. For
Oh,
peds,
you.
going to, but not for perio.
So you have to find a different way to live off?
Yeah. So I have to get more loans. So by the time I graduate, I'll be sitting on like freaking $1 million loan.
Yeah, I know. Don't.
Yeah.
You should be getting money, not paying more.
I'm going to apply to only schools that will pay me.
How many? How many schools are like? Do you have options to pay to?
So like for pediatrics, there's like, I think there's like almost like 100 programs out there, but for
Mm-hmm.
perio, there's
Only what?
maybe 50, maybe 40, not even
Oh, but that's still
programs.
not bad, right?
So I don't know. I feel like there's a lot less than that, honestly. Um, but yeah, it was just it's like so little in comparison to peds.
Yeah, of course.
I'm just like, dude, it's going to be really, really hard. And each program only accepts like 2 people.
Oh, damn, that's why.
Yeah, so I'm going to be applying, I think. So the periodontist, she was like, I asked her, I said, what is the likelihood of me getting in? And she said, Vicky, I am not saying this because you're my student, but I'm saying this because I know you will, and I guarantee you.
Okay, well, good.
I
And
was
she's the
like,
tough one.
and I was like, guarantee? She's like, yeah, just between you and me, I can guarantee you. I was like, oh.
Where? But where? Did she tell you where to apply?
She said to just like make a list. She said, so how many schools should I pick? And she's like 5 to 10. I was like, for Pete's, we were applying like 15 to 20. And she's like, I know, but for Perio, you only need like 5 to 10.
Okay.
And I was like, that's it? And she's like, yeah. And just bring me the list and we'll go over the list. We'll package you and then I will get you in. I was like,
Look at that. That's so nice of her.
it really is.
Can I
But then
ask, what month are you born in?
December.
Oh, nice.
What?
I'm just asking.
What does that have anything to do with this?
Because I was like, maybe I'll be this lucky. And I'm like, maybe let me see if we're born the same month.
What month were you born?
I'm October.
Oh.
Yeah, so no. Never mind. I crashed my dream already. I'm just kidding.
You're so crazy. How does that,
No,
what does that have anything to do with?
I
Anyway.
was thinking about luck, that's why. I'm joking. Okay, keep going. So this
So
is
funny.
great.
Not
This
even
is-
like the astrological signs. You're like month.
But yeah, because I was trying to see if you're a Libra or Scorpio or something.
Yeah, I'm a Capricorn.
Yeah. But this is so great. It makes your what you call it confidence better because you were so unconfident about yourself and that.
I was. I can't believe you sensed that.
Who? What?
You. I cannot believe that you.
I have very good sensation. That's what
Okay.
my manager always tells me.
That's actually very important. Okay. So blood away from the heart is okay, artery.
Okay.
Okay. So blood away from the heart, it's artery. So aorta, artery, arterial, all that. Okay. So obviously blood going into the heart is veins. Good.
Wait. But it's not the same as ventricle and
Ventricle and atrium are 2 different things.
yeah. They're the opposite. Goes in and out. But
Atrium and ventricle are going to be chambers, and then blood vessels are going to be artery and vein.
Okay.
Okay. Now, this and this are valves. We call these AV valves. Atrioventricular valves.
Okay.
We also have valves here, and we also have valves here. This is called a bicuspid valve or mitral valve. This is called a tricuspid valve.
Try what?
Tricuspid.
And the other one is bicuspid?
Uh-huh. So the way I remember it, it's like BLM, bicuspid left mitral.
Oh. Okay.
Okay. So remember, from the body, blood goes into the right atrium.
Mm-hmm.
Now here in the right atrium, it starts to fill. All the blood starts to fill. And when there's enough blood, that blood is going to push through the AV valve and then the right ventricle. When the right ventricle is full, it's going to push through the tricuspid valve and then go to the lungs. Remember, valves are there to prevent backflow. Does that make sense? We just don't want blood to go backwards.
To prevent
Forward.
back.
To prevent
Okay.
And then from the lungs, we have oxygenated blood that comes to the left atrium. It fills the left atrium.
Goes through the valve.
And then when it fills up, it goes back out into the body. Okay, so now let's talk about all of these blood vessels. This blood vessel is the largest blood vessel that takes blood away from the heart, and it has a special name. It is called the aorta.
And this is an artery.
This is an artery. It's the biggest artery. That's why it has a special name.
Biggest one. Okay.
This one is called the pulmonary artery. It's blood. It's taking blood to the lungs. Okay, and then we're talking about blood vessels that are bringing blood into the heart, right? So these things. So this one right here, okay, it's the largest vein in the body, so it's called a vena cava. We have inferior vena cava, and then we have superior vena cava. Superior vena cava, okay, so your heart is right here, right? Superior vena cava is everything from head to your neck, goes into the heart.
Okay.
Inferior vena cava is all the blood from heart down to your toes. All that blood shoots up into the inferior vena cava and into the heart.
Where is the inferior though?
I drew it like this, but in reality, the heart looks like this,
Yeah.
and it has like a thingy like this.
Okay.
So this is the superior vena cava, and this is the inferior vena cava.
Okay.
Yeah, I know I just kind of drew it like this, but you
No,
know.
it's okay.
And plus, the pulmonary arteries are supposed to kind of come up like this, and the aorta is supposed to come up like that.
Mm-hmm. So superior.
Maybe I'll.
And inferior. Okay. Okay.
So it's supposed to look like this.
Damn.
Does that kind of make sense? You're going to be able to kind of see it. Don't worry too much.
What?
So this right here is a right atrium, right ventricle. Left atrium, left ventricle.
Okay.
Okay. This right here are the AV valves.
Yeah.
Blood comes in through the superior vena cava down to the right ventricle, and then it goes up like this. Okay, so hold on. Let me show you. That's the pulmonary artery, and that's the vena cava. This one is the pulmonary vein. Okay, so draw it like 2D like me, and then if you start looking at the picture, it'll make a lot more sense. So again, pulmonary vein, blood comes in, right? And then it shoots up like that. Do you see that? Comes in this way,
Mm-hmm.
heart, and it shoots up like this, and it goes to the aorta.
Okay.
Okay. But we have superior vena cava, inferior vena cava. Blood pulls here, goes here, and then out to the lungs.
Damn.
Okay.
Confusing.
No?
When it comes through the pulmonary veins and it goes down and then goes back,
Pulmonary
where
veins
does it
this
go
way,
out?
this way.
Uh-huh.
Here's the blood, atrium, ventricle, and then it goes out this way.
On the three arteries.
Yeah.
Okay, okay.
So this is the aorta. So here, out this way, this is the aorta.
Mm-hmm, mm-hmm.
The aorta, it divides into small arteries.
Okay, okay.
Oh no, I almost
Look.
messed up. Okay, hold on. These are AV valves, but hold on. Man, I'm so dumb.
What?
These are AV valves, but this one specifically is a bicuspid valve. This one specifically is a tricuspid valve. I messed up. Sorry. Can you see?
Oh, okay.
Sorry. So then this one right here is the aortic valve. This one right here is a pulmonary valve. Okay.
Okay.
Okay. So far, so good?
Mm-hmm.
Okay. So you do have to know this, okay?
Yeah.
Okay. So I'm just going to organize the circuits. So mammalian heart, we have two circuits. We have the pulmonary circuit and then we have the systemic circuit. Okay. And then what happens is blood from the heart comes out. It goes through the aorta, divides into arteries, and then arterioles. And then it goes and undergoes exchange in capillary. From here, blood gets collected by the venules, the veins, and then the vena cava. And then from here, back to the heart.
Okay.
So what I need you to understand is that all of this and all of this, it does nothing but transports blood. Okay, it only transports blood. It does not do anything else.
Okay.
Good.
Mm-hmm.
And then from here, deoxygenated blood goes through the pulmonary artery. Pulmonary artery. And then it goes to the capillary. And then from the capillary, it gains oxygen and then it goes through the pulmonary vein and then back to the heart. But do you see that not all arteries carry oxygenated blood? Because look, this is an artery, but it's carrying oxygenated blood.
I'm getting. What? It doesn't matter because arteries are just taking blood away from heart. So it doesn't matter if it's oxygenated or not, right?
Yeah, but a lot of times when you're studying,
Yeah.
arteries will only be carrying oxygenated blood, except for the pulmonary artery. So that's an exception to the rules.
Do I need to know?
Yeah. But I know it makes sense to you, but they like to ask that question.
Okay, so say it again. Because
Pulmonary
I was
artery.
not thinking about it.
Pulmonary artery is the only artery that carries deoxygenated blood.
Only artery
That carries deoxygenated blood.
Blood. Okay.
Okay. All right, now that we know this, let's continue. Let's talk about the blood pressures. So for blood pressure wise, blood coming from the heart is going to have very high blood pressure because it's pushing it.
Okay.
Okay, so just bear with me. Okay, so aorta is going to have the highest blood pressure. And then artery, and then arterial, and then capillaries. Capillaries are always going to be zero pressure.
Because they're exchanging?
Yes, that's because one blood cell has to go through the capillary and they undergo exchange. Now, coming out of the capillaries, there's zero blood pressure. So trying to build pressure to go up is hard. So then this is venule, this is vein, and this is vena cava. Now, what you need to see is that the artery series are going to have higher blood pressure than the venule, than the vein series. Do you see?
Mm-hmm.
And that's just because the artery series, it has the heart pumping the blood out. Whereas the vein series are basically needing to swim from the middle of the swimming pool. Good.
Okay.
And notice arterial. There's going to be the largest drop of blood pressure. Largest drop of blood pressure here. Because to regulate overall body blood pressure. It's regulating all the blood pressures in the body. Okay.
Am I gonna write?
Dampen the blood pressure before it goes into the capillaries. Right? Otherwise, it won't be able to go into the capillaries, right?
So what is regulating it though?
So you know how like when your body has high blood pressure, your kidneys and all that, they are going to sense it. And then they're going to either like absorb extra electrolytes or get rid of extra electrolytes, make you pee or make you drink more, that type of stuff.
Okay.
Does that make sense?
Yeah.
Okay, good. All right, so now let's talk about electrical current, the heart's electrical current. So we have the AV node, SA node. This is the pacemaker. So the SA node is the one that keeps sparking. It's the one that initiates the electricity. When
Okay.
initiated, it sends it over to the AV node. The AV node is going to send information down the bundle of His.
What is this? What are they sending?
Yeah, hold on a second. Trust me. And then from here, it's going to go through all of these electrical fibers called the Purkinje fibers.
Damn, dude.
So SA node is what's going to initiate the electrical current. It will send it down to the AV node. When the AV node gets it, it's going to send it down the stalk of the heart, which is called the bundle of His. And then the bundle of His is going to radiate it out through all the through all the electrical nervous neurons, neurons around the heart at the apex of the heart. So this is number 4. So when that happens, the heart will start to squeeze, the muscles will start to squeeze from the bottom up.
Okay.
And when you squeeze the heart from the bottom up, blood squirts out. This is just a route for the electrical current.
So what would the question be?
Which one is a pacemaker? What happens if the pacemaker is messed up or whatever?
So if the pacemaker is messed up, the heart won't send the blood out, right?
Mm-hmm.
That would be the answer?
So if the pacemaker is messed up, then the heart will not beat. But for instance, if the Purkinje fibers are messed up, then everything will be contracted except for your ventricles.
Hmm. 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 Okay. Squeeze upward. Okay.
Does that make sense?
Yes.
Now that we have the electrical current stuff, let's talk about, oh yeah, I wanted to just quickly show you this, the arterioles. How do they actually regulate blood pressure? Okay, so these right here are the arterioles. These are going to be your venules, okay? I'm just going to pretend that these are your capillaries, okay?
Okay.
So what happens is blood comes in this way. Okay.
Mm-hmm.
So when it comes in, there are these sphincters. These sphincters can actually close. When it closes, blood cannot go into the capillaries. This is how we regulate. Now,
So it goes slowly, open slowly, or what?
That too, but sometimes it's completely shut. For instance, if your body is under a lot of stress, then your digestive system is not going to work. Because if you're running away from a big lion, you're not going to sit there and you're going to be digesting your food. You're not going to sit there making poop. You're not going to sit there and you're not going to, right?
Okay.
No, seriously. So then all the blood that's supposed to go to your stomach and your intestines and your urinary tract, all that will that's what the sphincters do. They squeeze the arterioles to reroute the blood to somewhere else.
Okay.
Okay.
And how does that regulate blood pressure?
So also sometimes like if you're getting too much blood, for instance, like I don't know, when you're blushing, for instance, that's a nervous system like thing, right? Your nervous system, your sympathetic nervous system is working. When that happens, usually we don't get a lot of blood onto our faces. Like the sphincters are kind of like kind of constricting, but when you want to blush, your sphincters open up. And all of a sudden all the blood starts to rush and then all of a sudden you start getting red.
Why do they open up though?
I think it's just a sympathetic. It's just our nervous system. Okay, the nervous system is just going to do that.
I think I'm gonna blush right now.
Oh my god. So does that make sense?
Yeah. It's
Yeah.
funny though.
Okay.
It's cold.
Okay. One more thing and then I'll let you go. I know we're over time, but
What?
let's
What?
talk about the lymphatic systems.
Okay.
He's such a skinny person.
I wish I was this skinny.
Hey, you don't want to be hella skinny.
Not hella, but skinnier than what I am right now.
Fine. I wish I were voluminous. Grass is always greener on the other side. Trust me. Okay, so the blood circulatory system is a closed circulatory system, right?
Mm-hmm.
But then this is the lymphatic vessels. The lymphatic system is an open circulatory system. So a lymphatic system, what it does, it's going to be absorbing the extra fluid between blood vessels. If it doesn't do that, then we end up with swollen parts of our body. So here,
Are you writing what it does?
I'm going to write something.
Oh.
Okay, so we have the blood vessels and then we have the lymphatic vessels. A lot of water starts to, because you know the blood vessels, we have water. Water.
Mm-hmm.
This area is called interstitial fluid or interstitial space. So there's going to be a lot of fluid building in the interstitial space. Okay. All that.
But why is that going out? I don't get it.
Because there's so much water in the blood vessels And all the water in the blood vessels, you know, everything is very fluid. So
Okay.
depending on the ion concentration, sometimes a lot, you know, the water like seeps through, right?
Mm-hmm.
The lymphatic vessel cannot suck in water. All that water will pool in the interstitial space. If that happens, then we end up with swelling. We say edema results if lymphatic system cannot absorb extra water. Okay. All this water then goes straight to the heart and increases blood volume.
So increases the pressure too.
Could, yeah, but it increases the blood volume.
So when it increases the blood volume, what happens?
I mean, because as the blood leaves the heart and goes to the rest of the body, it's bound to lose volume. It's just
So
replenishing.
okay. So when the lymphatic system absorbs the water, what does it do with it?
It's just basically going around vacuuming whatever the regular blood vessels left behind. Because the blood, it's kind of like an assistant. That's what it's doing.
Yeah, but I mean, like when it can't absorb the water anymore, then we have like edema, right?
Yeah.
But so it doesn't get to that point that it doesn't have any more space to absorb the water. What does it do to it? Does it sweat it? Does
No,
it
you
take
pee it
it to
out.
the oh pee? Oh,
Pee it out. Yeah.
okay. Hmm.
Does that kind of make sense?
Yeah.
Okay, cool. Memorize the heart.
Okay.
Memorize the heart.
I forgot it.
It's not a lot, but there's always going to be at least one or two questions because dentists, we deal a lot with the heart.
How?
There's especially like older patients, you'd be surprised. There's a lot of patients with artificial heart valves, artificial heart something.
Why do we need to know that if we're just dealing with a tooth?
Instruments that we use will reset the pacemaker.
Oh.
When that happens, you will end up having a patient who is undergoing a heart attack on your chair, and you don't want that.
So what do you do?
So you have to give them some type of antibiotic, and you have to not use that particular. There's like different instruments that we are not allowed to use for different types of heart condition or high blood pressure condition patients.
Damn, okay.
So that's why like we have to, yeah, which I'm having such a hard time right now, memorize some of these drug names because there's such a large number of patients who have high blood pressure, diabetes, um, heart failure conditions like heart attacks, all that other stuff,
Mm-hmm.
right? Because of that, a lot of a lot of the patients that come in will have drugs. And a lot of these drugs, we have to be able to know the names and be able to identify it.
Damn.
Yeah, it's a lot of drugs. It's a lot.
How many?
I don't even know. It's like right now we have like 50 some pages of drugs, just drug names.
Shit. Shit, that's a lot.
It really is a lot. And then depending on if the patient has high blood pressure, low blood pressure, whatever blood pressure, or diabetes, or whatever it is, it counteracts with the anesthetics that we use.
Ah,
Anesthesia that we use has epinephrine in it. And epinephrine, like one carpule, like putting one tube into a patient, it may not look like a lot, but it has to get metabolized by your liver. So one type gets metabolized by the liver, the other type gets metabolized by your blood. So with that being said, patients that come in with a huge abscess or like some type of infection or inflammation, one carpule is not gonna cut it. Sometimes you have to inject 4, 5, 6 carpules.
these.
Yeah, that will trigger some type of heart condition.
Oh.
So we have to memorize like how many carpules for what pound of patient, what type of drugs that patients are on. It's a lot. I didn't realize that it was this much either. Because I was same with you. I was like, we're just dealing with teeth. What the heck? Why do I have to memorize all this? But you do.
Oh my god. Okay.
So know the heart because
Okay.
they always ask you.
Okay.
Okay.
Can I take you with me to the test?
No, I want to take someone else for my test. Come on.
What? I couldn't hear that.
I said I want to
lost
take someone else for my test.
Okay. We can do it. Maybe we get the exception.
I know, right? It's so much. So
Ugh.
I guess this is
Okay,
why we are being called doctors.
they kill us to become doctors.
Yeah. Mariam, I will see you
Okay.
Saturday. Oh, was it Sunday? I forget now.
Sunday, Sunday.
Okay.
Okay.
All right. Bye.
Bye. Have a good night.
You too.